Posture and mobility naturally change with age, but many of these changes can be addressed through regular appropriate movement. Today we're covering 5 exercises that support spinal mobility, lower body circulation, hip flexibility, lower back relief, and rotational movement. Each targets specific areas that commonly become stiff or weak after age 50, contributing to postural changes and reduced mobility. These exercises can be performed at home with minimal equipment and are appropriate for most older adults when practiced with proper form and modifications as needed. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have existing back problems, joint conditions, or other health concerns. Understanding posture and mobility after 50. Posture is the alignment of your body during standing, sitting, and movement. After age 50, several factors affect posture, including reduced core muscle strength, decreased spinal flexibility, changes in bone density, and altered movement patterns. These changes can lead to forward head posture, rounded shoulders, increased spinal curvature, and reduced balance. However, appropriate exercises can help maintain and improve posture by strengthening postural muscles, improving spinal mobility, enhancing hip flexibility, and supporting overall body awareness and control. The key is consistent practice with proper form, not intensity or extreme ranges of motion. Exercise 1. Cat-cow stretch for spinal mobility. The first exercise is cat-cow, which promotes spinal mobility through gentle flexion and extension. Your spine naturally moves through these ranges during daily activities, but many people develop stiffness from prolonged sitting or limited movement variety. Cat-cow addresses spinal mobility by moving through flexion and extension, engaging core stabilizing muscles, coordinating movement with breathing, and improving awareness of spinal positioning. Here's how to perform cat-cow safely. Start on hands and knees on a comfortable mat, hands directly under shoulders, knees under hips. Begin in a neutral spine position, back relatively flat. Inhale as you gently arch your spine, lifting your head and tailbone slightly. This is cow position. Allow your belly to lower toward the floor. Exhale as you round your spine, tucking your chin toward chest and tailbone under. This is cat position. Move slowly and smoothly between these positions. Repeat for 8 to 10 cycles, taking about 1 to 2 minutes total. Important form points: move through your entire spine, not just your lower back. Keep movements gentle and controlled, never forcing range of motion. Match movement to your breath, creating smooth rhythm. Keep weight evenly distributed on hands and knees. Modifications: if kneeling is uncomfortable, sit in a sturdy chair and perform gentle spinal arching and rounding while seated. Place padding under knees if needed. If wrists are uncomfortable, try the exercise on forearms instead of hands. What to realistically expect: with daily practice over 4 to 8 weeks, you may notice reduced spinal stiffness, particularly in the morning. Improved awareness of spinal movement and positioning. Easier transitions between sitting and standing. Better breathing patterns. Spinal mobility improvements are gradual. Don't expect dramatic overnight changes or complete reversal of significant spinal conditions. Exercise 2. Calf raises for lower body circulation and ankle stability. The second exercise is calf raises, which strengthen calf muscles and support circulation. Your calf muscles help pump blood from your lower legs back toward your heart. Strong calves also support ankle stability, which is important for balance and fall prevention. Here's how to perform calf raises safely. Stand near a sturdy counter, chair back, or wall for support. Place feet hip-width apart, toes pointing forward. Hold the support with one or both hands for balance. Slowly rise up onto your toes, lifting your heels off the ground. Hold the raised position for 2 to 3 seconds. Slowly lower your heels back to the floor with control. Perform 10 to 15 repetitions. Rest briefly. Complete 2 sets. Practice 3 to 4 times per week. Key technique points: rise and lower with control, avoid bouncing. Keep your weight evenly distributed across the balls of both feet. Maintain upright posture throughout, don't lean heavily on support. Keep ankles stable, not rolling inward or outward. Modifications: if standing balance is a concern, perform seated calf raises. Sit in a sturdy chair, feet flat on floor, lift heels while keeping toes down. For more challenge once standing version is mastered, try single leg calf raises holding support with both hands for safety. What to realistically expect: with regular practice 3 to 4 times per week over 6 to 10 weeks, you may notice improved calf strength for walking and stairs. Better ankle stability during standing and walking. Reduced lower leg fatigue. Possible improvement in lower leg circulation. Calf strength builds gradually over weeks and months, not days. Exercise 3, Butterfly Stretch for hip flexibility. The third exercise is Butterfly Stretch, which addresses hip flexibility, particularly in the hip adductors and external rotators. Hip flexibility is important for comfortable sitting, standing, and walking. Tight hips can affect pelvic positioning and contribute to lower back discomfort. Here's how to perform butterfly stretch. Sit on a comfortable mat, firm bed, or carpeted floor. Bring the soles of your feet together in front of you. Let your knees fall outward to the sides naturally. Hold your ankles or feet gently with your hands. Sit upright with your spine relatively straight. Gently allow gravity to lower your knees toward the floor. Don't force them down. Hold this position for 1 to 2 minutes while breathing slowly and deeply. You should feel a gentle stretch in your inner thighs and hips, not pain. Important guidelines: your knees likely won't touch the floor, and that's normal and acceptable. Keep your back relatively upright, avoid rounding forward excessively. Breathe naturally throughout, don't hold your breath. The stretch should feel sustainable, not intense. Modifications: place pillows or folded towels under your knees for support if the stretch feels too intense. If sitting on the floor is difficult, perform a similar stretch seated in a chair with feet wide apart and knees falling outward. You can sit on a folded blanket or cushion to elevate your hips slightly if that's more comfortable. What to realistically expect: with practice 3 to 4 times per week over 6 to 10 weeks, you may notice gradual improvement in hip flexibility. Easier sitting in cross-legged or wide-legged positions. Reduced hip and groin tightness. Improved comfort during daily activities requiring hip mobility. Hip flexibility improvements are slow and gradual. Expect small incremental progress over months. Exercise 4, Child's Pose for lower back and hip release. The fourth exercise is Modified Child's Pose, which provides gentle lower back and hip stretching while promoting relaxation. This position allows passive stretching without active effort, making it accessible for many people with back stiffness. Here's how to perform Modified Child's Pose. Kneel on a mat or comfortable surface with big toes touching and knees separated comfortably. Slowly lower your torso forward, bringing your chest toward or between your thighs. Rest your forehead on the mat, a folded blanket, or a pillow for comfort. Extend your arms forward on the floor, or rest them alongside your body, whichever is more comfortable. Close your eyes and breathe slowly and deeply. Hold for 30 seconds to 1 minute, or longer if comfortable. Form reminders: only lower as far as feels comfortable, no need to force your chest to your thighs. Keep breathing naturally throughout. If you feel any sharp pain, gently come out of the position. This should feel like a gentle resting stretch, not intense. Modifications: place a folded blanket or cushion under your knees for padding. Put a pillow or bolster between your thighs and torso for support if you can't lower all the way. If kneeling is not possible, sit in a chair and fold forward over your knees, resting your forearms on a table or pillow. What to realistically expect: with regular practice 3 to 5 times per week over 4 to 8 weeks, you may notice reduced lower back tension and stiffness. Gentle hip flexor and glute stretching. Relaxation and stress reduction benefits. Improved awareness of breathing. This is primarily a relaxation and gentle stretching position. Don't expect dramatic strength gains or major postural changes, but rather relief and gentle mobility maintenance. Exercise 5, Supine Spinal Twist for rotational mobility. The fifth exercise is Supine Spinal Twist, which promotes rotational mobility in the spine. Rotational movement is often limited as we age but is important for many daily activities like reaching, turning, and looking over your shoulder. Here's how to perform supine spinal twist safely. Lie on your back on a mat or carpeted floor. Bend your right knee, keeping your left leg extended or slightly bent. Use your left hand to gently guide your bent right knee across your body toward the left side. Your right shoulder should stay on the floor or as close to the floor as comfortable. Extend your right arm out to the side. You can turn your head to the right if that's comfortable, or keep it centered if neck rotation is uncomfortable. Hold this twisted position for 30 to 60 seconds while breathing slowly. Gently return to center. Repeat on the other side, bending left knee and twisting to the right. Key points: move slowly and gently into the twist, never force it. Keep the shoulder of your extended arm as close to the floor as possible. You should feel a gentle stretch through your lower back and outer hip, not pain. Breathe naturally throughout. Modifications: place a pillow or folded blanket under your bent knee for support. If the twist is too intense, don't bring your knee as far across your body. Start with smaller ranges and progress gradually. Keep your head centered if neck rotation causes any discomfort. What to realistically expect: with practice 3 to 4 times per week over 6 to 10 weeks, you may notice improved spinal rotation and flexibility. Reduced lower back and hip stiffness. Easier turning movements during daily activities. Gentle stretching of lower back muscles. Rotational mobility improves gradually. Progress slowly and patiently without forcing range of motion. Creating a posture and mobility routine. Here's how to incorporate these 5 exercises into a manageable routine. You don't need to perform all 5 every day. Start with 2 to 3 that feel most beneficial for your body. A complete routine takes 10 to 15 minutes. Sample routine 4 to 5 times per week: cat-cow stretch, 8 to 10 cycles, 1 to 2 minutes. Calf raises, 2 sets of 10 to 15 repetitions. Butterfly stretch, 1 to 2 minutes hold. Child's pose, 30 seconds to 1 minute. Supine twist, 30 to 60 seconds per side. Daily practice options: cat-cow can be done every morning for spinal mobility. Calf raises can be performed daily for circulation support. Total time commitment, 10 to 15 minutes for complete routine. Adjust frequency and duration based on your schedule, energy level, and how your body responds. Important context and limitations: these exercises support posture and mobility but exist within broader context. They're most effective combined with regular walking or other aerobic activity as tolerated, strength training for major muscle groups, proper nutrition supporting muscle and bone health, and adequate sleep and stress management. They may not be sufficient alone for significant postural problems. Medical evaluation and possibly physical therapy may be necessary. They don't replace treatment for serious spinal conditions, arthritis, or other medical issues. You should consult a healthcare provider or physical therapist before beginning if you have recent back or hip surgery, significant spinal conditions like severe stenosis or herniated discs, chronic pain that hasn't been medically evaluated, balance problems making floor exercises unsafe, or uncertainty about appropriate exercises for your situation. Monitoring your response when practicing these exercises: pay attention to how your body responds. Positive signs include feeling less stiff and more mobile, improved ease during daily movements, better awareness of your posture, and sense of relaxation and well-being. Concerning signs include sharp pain during exercises, significant increased stiffness after practicing, dizziness or balance problems, or consistent worsening of symptoms. If you experience concerning signs, stop the problematic exercise and consult your healthcare provider. Some mild muscle soreness when starting new stretches is normal, but joint pain is not. Realistic timeline for improvements: posture and mobility improvements are gradual. Weeks 1 to 4, learning proper form and technique, initial body awareness improvements, some may notice reduced stiffness. Weeks 4 to 8, exercises feel more natural and familiar, noticeable improvements in flexibility and mobility, better movement quality during daily activities. Months 3 to 6, clearer improvements in posture and movement patterns, established sustainable routine, continued gradual progress with consistent practice. The goal isn't perfection or extreme flexibility but maintaining functional mobility and comfortable posture that supports daily activities and quality of life. These 5 exercises: cat-cow for spinal mobility, calf raises for lower body strength and circulation, butterfly stretch for hip flexibility, child's pose for lower back release, and supine twist for rotational mobility, provide a comprehensive approach to supporting posture and mobility after age 50. They address common areas of stiffness and weakness while promoting body awareness and movement quality. Start with 2 to 3 exercises that feel most relevant to your needs. Practice regularly 4 to 5 times per week. Progress gradually without forcing range of motion. Listen to your body and modify as needed. Combine with other healthy lifestyle practices for best results. Thank you for watching. For specific concerns about posture, back problems, or appropriate exercises for your situation, consult with a physical therapist or healthcare provider for personalized guidance. Subscribe for evidence-based information on mobility, posture, and movement for healthy aging, practical guidance grounded in research that respects individual capabilities while providing accessible approaches to maintaining function and independence.